Hey everyone, welcome back. If you're preparing for the NCLEX, this is one topic you absolutely cannot afford to miss: blood transfusion reactions. Now, I know this topic can feel overwhelming because there are so many reactions, so many symptoms, and every reaction seems to have fever and chills, but don't worry. In the next few minutes, I'm going to make this super simple, and by the end of this video, you'll be able to answer NCLEX questions on blood transfusion reactions with confidence. And before we start, remember this one golden rule. If a patient is receiving blood and you think they're having any kind of reaction, stop the transfusion. Stop the transfusion. Seriously, if you remember only one thing from this video, remember that. All right, let's jump in. Let's get started. So first, what exactly is a blood transfusion? A blood transfusion is when we give a patient blood or blood products from a donor. Maybe they lost blood after surgery, maybe they have severe anemia, or maybe they need platelets. Most transfusions go perfectly fine, but sometimes the body reacts to the donated blood, and that's where complications happen. Let's start with the most dangerous reaction: acute hemolytic transfusion reaction. It is vital to recognize this. This is the one NCLEX loves to test. Pay close attention to this one. Basically, the wrong blood is given to the patient. The patient's immune system says, hey, this blood doesn't belong here, and starts destroying the donor red blood cells. Now here's the symptom I want you to remember: low back pain. This is the key clue for you. Whenever you see a patient receiving blood and suddenly complaining of severe back pain or flank pain, your NCLEX brain should immediately think, we call this an acute hemolytic reaction. The patient may also have fever, chills, chest pain, fast heart rate, low blood pressure, and dark-colored urine. So what do? What are the next steps? Stop the transfusion immediately. This is the first step. Keep the IV open with normal saline. Notify the healthcare provider and blood bank. Monitor vital signs closely. Watch your patient carefully. Again, here is a favorite NCLEX clue for you. Blood transfusion plus back pain equals hemolytic reaction. Now let's talk about the most common reaction: febrile non-hemolytic reaction. Don't let the long name scare you. This reaction is much less serious. The patient usually develops a fever, chills, headache, and just generally feels miserable. Here is exactly how I remember it. The patient has a fever, but they don't have the severe back pain we saw with the hemolytic reaction. So if the question gives you fever and chills only, think febrile reaction. If it gives you fever and back pain, think hemolytic reaction. That's a very common NCLEX trick to watch for. Next up is the allergic reaction. This happens when the patient reacts to proteins in the donor blood. The symptoms are pretty straightforward: itching, hives, rash, maybe some flushing. Whenever I see hives during a transfusion, allergic reaction is the first thing that comes to mind. Now, if the reaction becomes severe, the patient can develop anaphylaxis. And that's when you start seeing wheezing, trouble breathing, swelling of the tongue or throat, and low blood pressure. At that point, it's an emergency. Stop the transfusion immediately and prepare for emergency treatment. Now let's talk about TACO. And yes, NCLEX students love this funny name. TACO stands for transfusion-associated circulatory overload. Think of it in this simple way: the patient received too much fluid too fast. The heart can't handle it, the lungs start filling with fluid. The patient becomes short of breath, you hear crackles. Their blood pressure goes up, their neck veins may become distended. So when I hear TACO, I literally think, too much fluid. That's it, too much fluid. The treatment is to slow or stop the transfusion, sit the patient upright, provide oxygen, and give diuretics if ordered. Now let's compare TACO with another reaction students often confuse. TRALI stands for transfusion-related acute lung injury. TRALI also causes serious breathing problems. So how do we tell them apart? What's the key? Here's the trick, here's the secret. TACO is the same as fluid overload. TRALI is the same as lung injury. In TACO, blood pressure is usually high. In TRALI, blood pressure is often low. In TACO, you see signs of fluid overload. In TRALI, you don't. The patient suddenly becomes severely short of breath and develops acute respiratory distress. If you remember that one comparison, you'll answer a lot of NCLEX questions correctly. Now let's talk about bacterial contamination or sepsis. This happens when the blood product is contaminated. The patient suddenly develops a very high fever, severe chills, low blood pressure, and can go into shock. Think extremely sick patient, high fever, shock symptoms. That is your specific clue for sepsis. Again, stop the transfusion and notify the provider immediately. Before we finish, let's do a quick rapid review of everything. Hemolytic reaction, back pain. Febrile reaction, this means fever and chills. Allergic reaction, this means itching and hives. Anaphylaxis, airway swelling and breathing difficulty. TACO, too much fluid. TRALI, lung injury and respiratory distress. Sepsis, high fever and shock. And finally, here is the most important NCLEX takeaway from today's video. No matter which reaction you suspect, stop everything. Stop the transfusion first. Stop it now. Then maintain IV access with normal saline, assess the patient, and notify the healthcare provider. That's it. If this video helps simplify blood transfusion reactions for you, make sure to review these memory tricks before your NCLEX exam. Thanks for watching, and I'll see you in the next NCLEX review session.